Project Plan Return to Travel series. Today our topic is making sense of the day. Our organizational team is myself. For those of you who may not know who I am, I'm Carmen Smith. I am the Senior Manager of Travel for ICF. I also have part of my team with me, Andrew Wilcox. He's the Manager of Travel of Europe and Asia. Tanya Faribault, who is on vacation today, Purchasing Associate for ICF, and Carly Van Dyke, who is our Travel and Events Assistant. Also, we have Charlie Grappon, who's Team Leader for Sales for Citizen M Hotels, Kathy Rigby, Program Manager for Travel Risk and Safety with CFA Institute. We also have some housekeeping items that we would like to go over with you. This session will be recorded, and you can start recording. Please mute yourselves. Please ask questions in the chat box, and those questions will be answered at the end of the call. Any questions not answered will be posted on the GBTA Return to Travel Think Tank site. Also, we ask that you keep your cameras off unless you are presenting today. Well, today I am excited about our call. We have two speakers that will be tag teaming today. The first is Dale Buckner. Dale is the president of Global Guardian LLC in Arlington, Virginia. He has been leading Global Guardian since its inception in March 2012 and is currently responsible for the day-to-day operations and its growth. Dale is a decorated combat commander with multiple combat tours in classified operations in Iraq, Afghanistan, Colombia, Haiti, Cuba, and the list goes on. Thank you for your service, Dale. We really appreciate that. Dale served in the U.S. Army Infantry for 9 years, Military Intelligence for 2, Special Forces Green Berets for 13 years, the Green Berets, I'm sorry, and he commanded 5 organizations, including an infantry reconnaissance platoon, Special Forces Scuba Team, etc. Dale has a bachelor's degree in criminal justice, business, and he has a master's degree in public administration and business administration, a master's certificate in strategic leadership from Cornell, and was a senior fellow at the Tufts University School of Law and Diplomacy. And we'll talk about that later, Dale. That is one of my dream schools. So Dale has earned a total of 27 awards and decorations, highlighted by his Combat Bronze Star Medal and Defense Meritorious Service Medal. So that is Dean Buckner. Also with Dean, we have Matthew Bradley. Matthew is the Regional Security Director for the Americas for International SOS, or ISOS as we say. Matthew is responsible for travel security assistance and assessments for all countries in the Western Hemisphere. And prior to joining ISOS, he was the Security Director for the largest mobile service provider in Honduras. Matthew spent 14 years with the CIA, with overseas posting in Chile, Argentina, and ultimately as Chief of Station in Honduras. Matthew is a sought-after speaker and interviewee for his expertise in travel risk management, crisis management, business resilience, counterterrorism, and enterprise security risk management. Matthew has been quoted in the New York Times, as the Washington Post, USA Today, Security Management Online, and other popular media outlets. Matthew has a bachelor's degree in electrical engineering and a Bachelor of Arts in Spanish Literature from Rice University and a MBA from St. Joseph's University. Matthew also studied Spanish, Latin America history at the University of Chile in Santiago and has traveled extensively throughout the world. I am totally excited today to have these two gentlemen. You can see their storied background, and I'm excited to hear more about that in their presentation. And I will send this over to you, Dale.
Thank you. Shannon, if you can bring our slides up. Couple of things here. Number one, here's our table of contents. We don't want this to be boring, and we certainly don't want to sound like Charlie Brown's teacher as we go into this. We did pick the topics today with Carmen based on the fact there's just a lot going on, and there's a lot of white noise out there. So as you look at this, we tried to zero in on the top 3 or 4 topics of things that, we think are top of mind and are concerning. And our goal here is really just to give you a different purview, a different perspective here with both of our kind of backgrounds and what we're living right now. The other thing I would say is Matt and I, we have no political point of view here. We're not briefing you as Republican, Democrat, blue, red. We're not briefing you as a Muslim, a Christian, a Catholic, a Jew, a Protestant. None of those things matter to us. We are trying to take care of our clients. That's our goal here. So I think Matt and I are incredibly apolitical, and I have to say this because our world has become so weaponized. And we start talking about numbers and the US versus this country and that country. We don't want you to think that we're weaponizing data here. We're not. We're going to give you what we think is going on based on what we're living every day and what we see in data with no agenda. And I hope that's understood across the board. By putting ourselves out there, of course, people can take shots at us and get upset if we're not following a certain agenda. We're asking you to not think in those terms for the next 45 minutes. We just want to talk about the topics and things that should be concerning to all of us and how do we get back to business. Next slide, please. Go in the other direction. There you go. So just a snapshot. All of you have probably seen this. These numbers are not new to you at this point. This data is about 2 years old. I just want to highlight a couple of things. We're headed towards 19 million confirmed cases. Now, you can always challenge the data and what's being recorded and where, but that number, if you would have asked us 6 months ago, would we be here at this part of the year in August? And I would have told you no. As you look at the hotspots in the middle, you can see from the US down into Peru, all the way to Chile, Brazil, of course, Europe, and then India are kind of highlighted. And then, of course, as you look at the 6-month mark, we're almost at 700,000 deaths. We'll cross that very quickly. So at the bottom, you see, are we flattening the curve? Does this feel under control? I don't think we're there yet. I think all of us back in March when we started these conversations thought by now we would have flattened the curve, not only here in the US, but globally. There are pockets of success, which we're going to show you and reiterate. There's also pockets of failure here. So we want to be right down the middle and honest to what we think that looks like. Next slide. Here's a global look at the death rate, if you will. And the two things that were a bit striking, if you follow that line on the US, you can see we really spiked back in April and then have come way down. That's a good news story. The other thing that was interesting as you look at the data, just to give you another perspective to compare and contrast, is you see India, Brazil, and the US. Now, this is a 3-day rolling average. This is 2 days old. So these numbers change minute by minute. But just for that snapshot, the key takeaway that we found to be a little bit, stunning was just look at 809, 730, 696, and then you look at the 4 countries here highlighted below where the numbers are just so small. So again, can we question that data? How accurate? All of that is to be debated, and I don't think we have an answer. But if we assume that this data is somewhat accurate, those are pretty staggering differential as you look at this. The other thing I think we've all learned is that everybody is vulnerable. We've seen countries get this under control and then have spikes as it came back. That's very real, and I don't think anybody would question that. Next slide. Here in the US, what we're seeing, and again, I think all of you get a full dose of this every day. You get it when you're in your car listening to the radio. You get it online every day. You listen to it or hear it on the news every night. These numbers won't surprise you. I think what is really kind of interesting to do is think about what does this look like over the horizon? So if we're recording 67,000 new cases on average a day here through the last week, we are seeing signs that is coming down in certain pockets, which is good news. If we've now reached 4.5 million plus across the board of confirmed cases, that number has gone up since we took this snapshot, and we're at 158,000 as of today in death rate. The real question is, how big is that going to get as we go through the fall into the winter, assuming that we're going to see a vaccine? So as you look at this, will we see, number one, 200,000 deaths in the US by September or by the end of September? And I think the answer is probably close, pretty certain to be yes. If we assume that a vaccine is 6, 8, 10, 12 months away, and then you have to manufacture it, then mass distribute it, all those things, and Matt will highlight some of these challenges. Do we see 500,000 dead Americans before we get this under control? And to think that we could have 500,000 Americans die from this, just to put that in a little bit of perspective, in Iraq and Afghanistan, after the longest protracted war in our history, we've lost a little over 7,000 service members. At 9/11, we lost a little over 3,000 people in the attacks. We've now had the equivalent of 53 9/11s. So I point that out just to give you some perspective of how broad this is and how big it is. More importantly, how big will it be, and are we going to get to 500,000 dead Americans before it's over as we go through this process of finding a vaccine? Next slide. What's going well? I'm going to go through these quickly and then hand off to Matt on how to manage through this. There are positive signs. As you look at Germany, as you look at that, there's 83 million people in Germany, full population. There's been just a little over 500 deaths. As you look at South Korea, there are 51 million South Koreans, and they've had 300 deaths. So these are positive signs, and they're examples of pockets in Europe and Asia where there has been a flattening of the curve, and this feels relatively under control. Obviously, you're hearing great, this warp speed on the vaccine. We think that there's 3 or 4 key organizations that are ahead on that and moving quickly. Great news. Testing around the world and right here is getting better every day. Great news. I think understanding of the virus is getting better at scale for not only the United States, but the world. All these things are wonderful kind of tidbits and data points as we go along the way. Matt, you want to comment on the 5th bullet down?
Yeah, thanks a lot, Dale. I appreciate the opportunity to present with you, and thank you for giving us that situational update. I think you'll see a theme here as we talk about masks in multiple places. As Dale said at the beginning, we're risk managers and security professionals, so our goal is to protect people, not to make political statements. I like what we have in this slide here: no shirt, no shoes, no mask, no service, right? Nobody would think about going into a restaurant or, a store without shirts and shoes, and now we're going to become a condition to that. One of the things I want to draw out is I live in Pennsylvania, and I think this cultural adoption of mask wearing is critical. And those locations that adopted masks early became part of the culture. And I say here in Pennsylvania that we have the culture of mask wearing because masks were mandatory from the start of the lockdown, right? So since March, we've all been wearing masks when we leave. I contrast that with my relatives who live in Texas. So I'm talking about my relatives. I'm not talking about Texas, but my relatives in Texas who I went to visit, who, mask wearing became mandatory in July. And of course, by then they had been locked down and then released, and there was no culture. So it was very difficult to get them to see the use of that. But I think it's going to be important as we go through the extended COVID period that masks become culturally adopted to help reduce the spread.
Next slide, Sean.
Yeah, the rest of these, the limited number of people, and other issues that are out there. Sports returning. I mean, these are good news, right? This is good news about people coming back in limited numbers. Sports returning to some degree, and we've seen some successes there. So, we want to acknowledge that things are moving in a positive direction in some cases.
Yep. As you look at this slide, again, I would say there's nothing new here. You've heard this story. I think number one is as you're looking at who you're going to bring back into your office or back into your manufacturing site, your auto plant, all of those things, this concept of who is key and essential is hotly debated. And I think it's really important as you go through this. But I think more than anything, to Matt's point, the adoption of this, the acknowledgement that these 5 or 6 items that we have bulletized on this slide and the execution and support of that, this is the only way we're going to all get back to business at scale. the acknowledgement and the adoption of this as a country and as a globe until we have a vaccine, without it being politicized, without it being weaponized. If we want to get back to work, we have to have populations feel safe and secure, and these are the paths we have until we get there. So ultimately, our message to all of you, and it includes ourselves, is we want to get back to business. Therefore, we're going to have to adopt this new normal in order to get there. And wherever you sit, without the politicalization of these terms and these topics, that really seems to be the key takeaway across the board. Next slide. Here is a bit of other good news as you look at this. The U.S. airline utilization, you can see we go from about 75 million all the way down to 2.9 million in an incredibly short period of time. That being said, just in the last 45 days, you have seen upticks. So I won't read the slide to you, but knowing that American Airlines is going from 32,000 passengers in April to 110,000 passengers in May, that's a great sign. That to us indicates that things are starting to open up a little bit. More importantly, people have some level of confidence, right? That they feel secure enough with the cleaning protocol, the screening protocol, the mask wearing protocol, so on and so forth, to get out there. And I think that's a positive sign. United Airlines, same thing. They're up back to about 30% of what they were in 2019 in the same month. Ultimately, we want people to create this sense of confidence, because I think that's how we get there. The only way we're going to get there, though, is having standards, which we're going to get into when we talk about things that aren't going all that well. But these are at least good signs. Next slide.
Yeah. And Dale, I think the one point on that is obviously our business is based a lot on travel. And, one of the things when you look at the return to travel, people coming back, is that, those are the people who are risk tolerant or maybe, don't believe as strongly in what's happening from a COVID perspective. But to get to those previous levels of travel, it's going to take process and procedures from the airlines and the airports to get all people safe and all people comfortable. So now you're talking about people who are more risk adverse or in a more vulnerable situation before we get back to that, right? It's not going to be the same people traveling over and over again. We have to expand that population of travelers, and that's only going to happen when people feel safe about getting on a plane, not just people who are willing to take a big risk.
100%. Thank you. Next, and Matt, these next few slides are all yours, please.
Yeah, thanks, Dale. And I want to talk, one of the things that we found for our clients is their discussion about the return to travel, right? We all saw that, travel activity fall off the cliff, and now it's starting to come back. But what it means is that you got to have a framework for returning to travel, just like you have a framework for returning to the workplace. And so we've been working with that. And what I'm going to outline for you here is that strategic framework, right? We've broken it down into 6 pillars. I'm going to spend a little bit of time because I want to go into detail on each one of these pillars for you. But really, we are answering 2 key questions when we talk about travel, right? The very first question that you ask is, can I go? Okay, because that's the most important thing. Can I even go there? If you're asking yourself if you can go to Colombia, the answer is very easy. You cannot go to Colombia because the borders are closed. They are not accepting people in there. The second question you need to ask yourself is, should I go? Right? And so the framework is designed around answering those first 2 questions. And then once you've decided to go, how you mitigate and stay safe while you're on there. So the first thing that we have is a destination assessment, right? That is what answers that question. Can I go to destination X? And of course, what we want to realize in the age of COVID is that all countries had inherent risks pre-COVID. They had medical and security risks. So a country that was high risk from security or a medical standpoint in the past is still high risk medically or security today. It also has a COVID impact on top of that. So you want to take that into account when you're looking at your destination assessment. And obviously, we're assuming that it's okay, that it's physically possible to go there, right? Flights are open, the airport is open. But then you want to look at what is the public health status, right? So should something happen to you when you go, that you'd be able to get treated. Transportation infrastructure, restrictions on society, political instability, lots of issues. So that's the destination assessment. The next is the pre-travel approval. I'm seeing some comments saying that my voice is breaking up. Is it breaking up for you now?
Just a little bit, Matt. Maybe you can speak slightly closer to the mic, maybe?
Okay. The second question we want to ask is, should we go? Pre-travel approval says, what is essential travel? Right? What is essential travel? And that has to be defined. That has to be defined by each organization. So first of all, you define the criteria. Then you create a process for how you're going to approve the travel. Then you identify the approver. Then you run through the process to get to that ultimate answer. And you used to do this in the past. You would have done this for all trips. But now you may have done it for high-risk trips, but now you're doing it for all trips. Okay, so that pre-travel approval now applies to all travel, and the approval levels may have been elevated. It's not uncommon for us to hear that it needs to be also approved up to the CEO or business line manager. The next is, what do you do during travel, right? So you prep people before they go, and then you have some things to do during travel. So we'll talk a little bit more about pre-travel actions. And then there's the escalations, what happens when you're there. That can be different whether you're an expat or a traveler. So if you're a traveler and there's a second wave, you might just pull out. If you're an expat, you might decide to stay through it if it's not expected to be as hard. I'm still seeing some issues with the. Why don't we continue on, Dale, and skip over my slides, and you go on to the others, and we can come back to the resuming travel. I'm going to dial in.
Okay, very good. Shannon, let's skip forward a couple. There we go. Go back one. Well, let's stay here. What has not gone well? And we'll come back to a couple of the solutions Matt and I had kind of wanted you to hear. We'll come back if he comes in cleaner. This is really a little bit sensitive, and I want to state that up front, but I think it's reality, and I think it has to be discussed. And I think there's key lessons learned for all of us in the travel industry and or people that are trying to protect our personnel and our firms. Next slide. And hopefully you can see me here. So as you look back at this, I'm assuming that most of you have heard or seen or have been affected by the simple fact that when this really started to get momentum in March, you saw an enormous amount of people get stranded around the world. There are still companies that have people stranded to this day, believe it or not. That is real. When this first started, the State Department first put out, there was about 5,000 Americans stranded. Then that number went to 13,500. Then it went to 50,000. Ultimately, it took over 3 months to get this under control. And my point has always been to all of my clients is that if you've ever worked with an embassy, if you've ever lived abroad and dealt with an embassy, the embassy is not there. They are not manned. They are not trained. They are not equipped to manage large-scale evacuations. There seems to be this misnomer out there that somehow, some way, the State Department has a quick reaction force and has Marines with vehicles that's going to go get stranded Americans. And the simple fact is, it's not true. It isn't true today. It never will be true unless there's a massive change in the mission of the State Department and what it's there for. So when you have a global event like this, the key lesson learned was for most, because I see a lot of these programs, I think Matt and I probably both see this often, where in the program of duty of care associated with global travel, there is a tire instruction that the U.S. State Department is there and is going to be able to help you. And my answer to that is yes, but very limited, and it's very narrow what they can help you with. Don't expect them to have a rolling convoy that's going to come get you where you're at and get you out of the country when there's a terrorist attack, an earthquake, a hurricane, or a pandemic. It's just not real. So I reinforce this to say, We had clients that we had to go in and get because the commercial airliners had canceled over and over and over. We had non-clients that the State Department couldn't get them out, and we had to go in and get them out. And it was, from the time we'd be alerted till they were out was typically 48 to 96 hours, and we would go. And we brought people that were non-clients because it was so chaotic and so many people had depended on this. The State Department of the U.S. government is going to get me out of here, and it just didn't happen. And as you saw the commercial airliners contract and stop flying routes, people were sitting there for weeks waiting for the commercial airliners to save them, and that didn't work very well either. So as you think through when there is a major event, again, a volcano explodes, a terrorist attack, an earthquake, hurricane, whatever the case might be, this concept of the U.S. government saving you is just not very real, and we want to reinforce that. The other issue that we have right now, and again, I'll reiterate, not coming from a political perspective, there is no U.S. centralized plan. There is no global standard right now. So as you look at this, we have 50 governors all doing what they think is right, and God bless them for it. You're now starting to see governors pair together to create more synergy. We have no standard with American Airlines or American U.S. carriers, let alone international standards for how they're preparing the aircraft. So the good news that we just got done stating was that, yes, we're seeing more travelers. To go from 30,000 to 110,000 in 1 month with American is a good news story. The issue we have, to Matt's point about confidence and feeling secure, if we don't have one standard, and Delta, United, American, Southwest, blah, 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 and Emirates all have a different standard, how does the passenger feel secure? So I think we're limited until the US FAA puts out a standard. And if you're touching the US FAA in your job, or you're touching the UN, or you have relationships there, we're sounding this bell as a company. We're talking to the Vice President's office. We're talking to the State Department. We're talking to our contacts at the US FAA to say, look, if you don't create one standard, if Delta Airlines is allowed through September to only have 60% of their aircraft filled with no middle seat, and they have a very strict standard, and JetBlue and Southwest are reducing, cleaning, and filling every seat they can, that's not going to equate to confidence. So I think for the long haul, that is really the issue we're talking about here. Lastly, big surprises. Many of the Fortune 500 companies that I think Matt and I support, I think when this kicked off, we're looking for medical insurance and certain evacuation platforms to be covered. And because it was a pandemic, if you read the fine print, it was not. So there was a lot of frustration. And what I saw in real time, and I think Matt would back this up, is I think we saw a lot of frustration with HR directors and security directors going, I didn't read the fine print. I didn't see that, kind of line about pandemics. And now what do I do? So a lot of friction there, which goes back to read the fine print, know what you're getting, and understand your restrictions. And then lastly, the folks, I think we overemphasize the value of travel tracking. Number one, it's about 75% accurate at any one time, and the value of alerts. If I'm in Egypt and I get an alert that says they just closed the border and now I can't get out, what's the value of the alert? It's like being at the Vegas concert and receiving an alert that says there's a guy shooting everybody out of a hotel room and I'm in the middle of the melee. There's not a lot of so what there. So again, lessons learned are understand the value of what you're utilizing as your duty of care platform, and understand, most importantly, the restrictions of that. What are the constraints of what you're getting? And always ask yourself, okay, I have a travel tracking platform. Now it's gone off. Now what happens? What's the so what there? And if you don't have an answer, that's where we think corporate headquarters fail on a consistent basis. Next slide. Economic outlook, it's right at 1:30, so we're doing well on time. I just want to spend just a quick snapshot here because we want to highlight, where we think we sit here. And I don't think we built the slide to be simple. You don't need to have a finance degree or an economics degree to understand that slide. When you viscerally look at that and you run your eyes from left to right, the chart on top is from when we first, started monitoring the finance and the GDP of this country. And then we did a snapshot from 2012 till today. A couple of things. I think this slide tells one story. I think that as you look at this, you're seeing we've had the largest drop in GDP in our history. And ultimately, we're now in a race. The government, the US government, has propped the country up financially with aid. The question is, how long can the US government print money to do that while we're waiting for a vaccine? If we get to the point where the vaccine is not delivered fast enough, that is when you're going to see a financial reckoning. Right now, we have an artificial prop that's keeping our economy up and our country functioning. If we lose that, we've got a real problem. And when you look at airlines talking about they won't rebound till 2024, if this carnage starts before we get the vaccine, it's going to, just multiply 10 times over. So I think all of us should be very conscious of what is that timeline. Watch the vaccine as much as you can in the development of it, and we'll see where this goes. Shannon, can you go back to Matt's slides and see if we can get him back on? One more forward. No, forward, sorry. Go the other direction. There you go, right there. Matt, can you pick up?
How's it sound? How's it sound, Dale? Is it okay?
Very good. I can hear you clearly.
Okay, great. Thanks. And I will send through in the deck the detailed slides for the return to travel framework. Okay, so you don't have to listen to me say it again. I'll just send the slides through and you'll have the details on that. We talk about resuming travel. We have three things here that we want to talk about. One that I always advise clients is to plan now. So before the travel starts or the volume increases is when you put that framework in place, when you put those processes in place. Okay, so start thinking about it now, even if your organization hasn't fully resumed travel. Always talk about making advice and assistance available to travelers, being able to call in, talk to people like Dale, talk to my teams as well about what you do before. I sit here in our assistance center in Philadelphia and I hear my guys talking all day about people who want to come to the United States, right? That was not the calls that we were taking prior to COVID-19. And in fact, people are asking about traveling state to state because, as Dale mentioned earlier, every state in the United States operated like its own country and has a different policy and different process. So that makes it difficult, but that means that you have to give that advice so that people can travel even on trips that used to be no-brainers in the past. And then we encourage people to be flexible in the planning and execution, right? You might need to move around dates. You might need to have contingency plans in place. We know that the situation will change. If there's anything that we've been talking about here, it's the fact that, nothing is guaranteed. This isn't going to be a constant. It's going to be a fluctuation, and we have to be flexible on that. There are some precautionary measures that we recommend on the next slide, Shannon. And I'm not a doctor, but I was authorized to present these for you. And I'll just talk about a few things related to travel before, during, and after, right? Traveler preparation is about training, right? You want to make sure that people understand what travel is about, how to prepare themselves before they go, how to operate in the airport, on the plane, and then when they're in that hotel. Travel kits, right? Your employees will be expecting you to provide some of these mitigation measures. So are you going to create travel kits and how are you going to get those out to everybody? Preparing people for quarantine, right? Whether it's on the front end of their trip when they arrive at their destination, maybe the meeting is important enough. Maybe you're sending an expat back and they're going to have to quarantine for 14 days. Here in the United States, we self-quarantine in our house or the location where we're going to live. In other countries, it's government mandated quarantine, right? You might go to a hotel that's owned or operated by the government and be stuck there for 14 days. So how do you prepare people for that? And even things as simple as packing, right? I myself like to carry on, as I'm sure most people do, especially if you have a short trip. Now you're talking about, if I go to another country with just a couple days of clothes, will I be stuck there for 2 or 3 months with those same clothes. So maybe I need to pack a little bit heavier to be prepared for that. Social distancing, we all know what that is, but the point is it's our responsibility, right? You've seen those videos, kids walking around in South Korea with 3-foot poles on their shoulders so they can maintain their social distance, right? Pretend like you have those 3-foot poles hanging from your shoulders and you're keeping the distance from everybody else. What our doctors say is assume everybody else is infected, and how close would you actually want to get to them, okay? Hygiene, obviously, our doctors always talk about hand washing and hand sanitizer. I think the biggest cultural adaptation for us is the idea that there won't be handshakes. You go to a business meeting or you meet a new person, there won't be handshakes for the near future, right? So how do you avoid that? What do you do instead? Everybody's into that cultural adaptation that we have to make. And then PPE, again, the part about PPE, whether it's masks, gloves, wipes, sanitizer, is your employees are going to be looking to you to provide that. If you want them to go on a business trip, they're going to ask you for the PPE. They're not going to be expecting to buy it themselves. The one thing we like to say is share this information with your employees, right? Knowledge is power, and it helps to increase their feeling of control over the trip. It helps to reduce their anxiety, which is what you want. And then finally, I don't know if we covered the changes from the pandemic and the way it has affected evacuations. There's security evacuations, which is evacuations or repatriations of people who are not sick. And then there are non-COVID evacuations, right? Medical evacuations for someone who's sick from something besides COVID. And then obviously there are COVID evacuations. And so during this time, we've still been able to do hundreds of evacuations of both COVID positive patients and non-COVID patients. And while we might have talked about those evacuations happening in hours in the past, we now have to start thinking about them in days because of the restrictions that are present in the countries where you're trying to evacuate. I want to tell a quick story about a repatriation of clients from Peru, right? So Peru was one of the few countries that locked down their borders entering and exiting, right? So they didn't want anybody to leave the country. They didn't want people at the airport. And so we were working with the embassy, the US Embassy, to try to get permission from the Peruvian government to fly charter flights in there to pick up our clients and bring them out. While we were working with the government, the US government was also trying to get permission to get their own repatriation flights in. So ultimately, it was easier for us to get our clients, non-sick patients, clients, onto the repatriation flights from the US government instead of chartering our own, right? So using a creative solution, which actually didn't make any money for International SOS since we didn't put on the charter flight. And so, but we were able to get dozens of our clients out of there on those repatriation flights. I think, Dale, you wanted to share one on the medical side.
Yeah, I'll just reiterate, we're in the middle of a security evac in Beirut coming out of the explosions a couple of days ago. And we're in a medical evac right now in the Caribbean. And just to accentuate how much more difficult this is, in Beirut, you can imagine every hospital is completely overwhelmed. There is so much carnage in Beirut and so many injured people that the hospitals are packed. Well, in order to get on a plane to fly from Beirut to the UAE, you have to have a COVID test within 72 hours. Well, no hospital or clinic right now will issue you that test because they're overwhelmed with the casualties from the explosion. So now we're moving our clients way, way, way out of the city to other cities to find a hospital and clinic that will give that test within 24 hours, and then having to move them in and getting to an airport to get them out. At the same time, in the Caribbean, we have a couple who have now contracted COVID. They're sick. They want to be taken out of St. Bart's back to Los Angeles. So we're going to air ambulance them back. If you know St. Bart's or if you know St. Martin, they have a French side and a Dutch side, even on the same island. So if you were to go from the French side to the Dutch side on the same island, you've got to have a valid COVID test in the last 48 hours. So you start to see the largest airport with a over 5,000 foot runway is on the French side of St. Martin, and getting folks from the other side is now become a bureaucratic nightmare. So I would just accentuate the fact that COVID is going to make everything we do on a global stage more difficult. And to Matt's point, to requote him, Things that we thought of that would happen in hours are now going to take days. And I think that's very real. And I think everyone should kind of put that in your brain and understand that we used to be able to do things in hours and it's now taking days. And that is a reality of what's going on. Shannon, can we move forward and skip all the way to second, third order effect? There we go. Matt, I'm going to let you take this. Next slide, please.
Yeah, thanks, Dale. So talking about that same thing, right? How does COVID affect our other risks and the other things that are happening here? Of course, the last couple of weeks we've seen, we're in the middle of hurricane season. We've seen a couple of tropical storms come through. We just had tropical storm Isaias come through the Philadelphia area and the eastern seaboard. And so when we talk about what might have been an evacuation order for people to move inland, it's impossible to be able to put people into shelters, right? So what are we going to do? Now you're standing fast, maybe in a location that might not be the safest place. Petty crime is important, is already your biggest risk as a traveler, and it's going to be exacerbated for two things. One is there are going to be fewer business travelers, right? So you're going to be a bigger target if you are on business travel because you're going to be one of the few foreigners who is there. And then also because of the economic conditions in the location where you're at, whether it's a developed or a developing country, it's still going to be economically depressed, which means there are going to be more people who are turning to crime to help them feed their families. Civil unrest has been an issue, especially in Latin America during 2019. We saw it big in Hong Kong as well last year. We've seen lots of it in the United States, and we can expect that will continue. Some people are protesting the response or lack thereof in their particular country, and others are protesting or demonstrating for other social issues, and that is causing them to come into contact with people who are infected with COVID-19. And so, that reducing of the social distancing, those large gatherings where people come out and demonstrate for legitimate reasons will continue to fuel the infections in certain locations. I don't know, Dale, if you wanted to add anything to that.
Yeah, I'll just give a slightly different perspective. I'll go right in order from left to right. Natural disasters. We're on our 9th storm already. It's the first week of August. We believe, NOAA's forecasting 22 named storms. I'm telling everyone that will listen to us, if there is a hurricane that comes through the Gulf or comes through the Atlantic out of the Caribbean, we had evacuated over 1,800 people in 2017 when 2 back-to-back hurricanes hit the Virgin Islands and Puerto Rico. If there was another strike like that in any of those regions, what we could do in the speed at which we could do it is absolutely going to be much more difficult and slower. And the rebuild, Puerto Rico hasn't even finished coming back from 2017 yet. They're not even close. They get hit again. They haven't even finished rebuilding. The rebuild this time, because the supply lines are strained, because you're not going to have a workforce that can come in and do the drywall work, do the wood framing work, do all those things at the same pace we could 3 years ago because of COVID. Everything will be harder and slower. That's really my message to all of you. On crime, as you're watching this, I have to preface this, and this is a bit sensitive. Crime in the United States has been coming down aggregate for 30 straight years. You're now starting to see spikes in murder, child abuse, spouse abuse, auto theft. All of those things are spiking right now. That is real. It doesn't mean it's everywhere. It's in pockets. And I think obviously you can tie those spikes in crime to where you see a lot of unrest. And I would simply say this when it comes to the unrest. And I know this, can turn some people off politically, but I think it's worth saying. I think there are good police and I think there's bad police. I think there's good people in every company in America, and I think there's bad people in every company in America. I think there's peaceful protesters, and I think there's people trying to take advantage of the protests. I think either extreme of any of those topics, none of it's good on either extreme. What has to happen in our country as we go through this is there has to be some reckoning of common sense and decency. And as you go through this, I think we're struggling again because we have become so polarized and so politicized that we're in a strange place. I am 52 years old. I have never seen the country this polarized over its politics, over its sexuality, over its religion, or over its race. And what I would say is this: whether President Trump is reelected or Biden is elected to be the president, what I am hopeful for as an American is that either way, whoever is elected in November, we can bring the temperature down. If President Trump is reelected, then I'm hopeful he doesn't feel pressure to be reelected and he can bring the temperature down. If he's not elected and Biden takes over, I am hoping he can soften the message and bring the temperature down. We have gotten to, on a scale of 1 to 10, we're operating at a 20 right now, and it's not good for any of us. I have lived abroad and operated in over 70 countries in this world, and I will say this, when I would come home, always, 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 the one thing that felt different being in America compared to most of the rest of the world, not including Western Europe and some of the more developed countries, was that our sense of nationalism, being an American, not I'm a Catholic, not my family name is Buckner. Those things were all, my family and my religion and my political party were always secondary and tertiary to I'm an American. Somehow we've gotten down kind of the wrong rabbit hole, which is creating a lot of this unrest. So all I can say is, and I know you're all living it in your own view and your own kind of straw view of these items that are affecting all of us in business. Ultimately, all I can say is, I hope that we can find our way back to being civil, and we can find our way back to a national platform that being an American and participating in our structure, falls back into some level of normalcy. But I'll tell you, I understand the unrest. I understand how we got here, and I understand the background of it. And some of it's deserved, some of it's not. But in the end, finding a way to the middle and common decency is going to be the way we get out of this. Next slide. So this is our summary. I don't think any of this will surprise you as you look at this between what Matt and I have stated. I think all of us should be thinking in terms of we're not going to fully be able to bring back the country until we get a vaccine, which means we've got to hang on to get to the other side and get to a vaccine. In the interim, we've got to find a way to standardize things so that people feel safe, so that we can start moving and getting businesses going. If they don't feel safe, none of this is ever going to move. Obviously, as you look at the economy, I think we hit that pretty strong. And then lastly, we're going to see, as artificially as the government is holding up the society, the longer this goes on, the more that's going to be frayed and the more desperation you're going to see in certain pockets of our society. I think the social fabric of our country right now is going to be tested until there is a vaccine. And I don't think we can escape that reality. I think it matters. So we'll pause there. We're 2 minutes over time, so we didn't do too bad on time. Carmen, I'll pass it back to take questions for Matt and I.
Great. Well, thank you very much, both of you. I know that I have a couple of questions. I thought the presentation, again, it was different than what we hear on most occasions, and it's something that the facts there, and there are some surprising information. Just very, very happy with the presentation. Thank you so much. I do have a question, and then I'm going to hand it over to you, Andrew, to moderate the questions if there are any. But my question to you is, we're always told to register through Smart Traveler so that the embassy knows where we are when we're traveling and give our locations. Can you guys speak to that, and why do we do that? Or if given part of what you said, why would we continue to register? Just if you can talk to that.
Matt, you want to go first, or we can both give our opinion there?
Yeah, I'll take it from our experience in Peru, right? In connection with the embassy was using the people who were they were using the STEP program and the messaging system to communicate with people in Peru, to let them know about repatriation flights. So what Dale said about, the embassy, bringing in an aircraft carrier or a jumbo jet to take everybody out is not going to be the case. But if they get charter flights or they have options, they are going to notify people via the STEP program. So still important to use that to get those alerts, but not to say, well, they know I'm here, now they're going to come and get me.
Yep. And Carmen, I would answer it almost identical. I don't want to reiterate, but I would simply say I would still register. I'm not saying that the embassy and the State Department are completely failed here. What I'm saying is I think as travelers, as Americans, we have to taper our expectation. I find this amazingly in most Americans that they simply expect too much, frankly, from these embassies. Again, they are not manned, equipped, or funded for these mass scale evacuations. It's just not real. Now, if it's on a much smaller scale, or you find yourself when there's, in a country when there's not an issue, these programs are incredibly valuable and can work very well. I put that out there because I'm hesitant, and I think we missed the mark where we think as Americans or as business travelers that embassy can manage things at scale, and it's just not real. It's not that they're not great Americans. It's not that they're not serving. It's not that they're doing all the right things. It's just simply the platform is not built for these kinds of events, and I think it's just the acknowledgement and expectation they can't solve all your problems for you. That's really the takeaway. But you should still continue to register and use those platforms.
Awesome. Thank you. Andrew, do we have any questions?
There's not so far. There's been a couple of comments. Fabulous presentation. Thank you. Second that comment. Excellent. Thank you. And I actually thought this was an excellent presentation. I'd like to thank you both for that. If any of you do have any questions, please put them in the chat box. We'll get to those now. We do have we're scheduled for another 9 minutes. If you have questions afterwards, they will be followed up, and you will receive them through as Carmen said, through the GBTA site. So if you do have any questions, please put them in the chat box. Well, there haven't been any at the moment, so I don't know if you just want to wait for a few more minutes to see.
Yeah,
sorry, there is a question.
Go ahead.
From Teresa Wilson. When we start to consider resumption of travel, especially international travel, how can we help to ensure those potential travelers remain safe, considering COVID is so widespread? Should potential travelers pre-quarantine to help reduce exposure? Any other ideas? And that's to Matt, would you like to go first?
Yeah, I'll start on that one. So, again, going back to travelers going overseas, you want to make sure that they're comfortable before they go. We don't recommend pre-quarantine. We don't recommend people testing before they go if they're not symptomatic, right? One of our doctors who also has a PhD in infectious disease always tells me, he's like, we are all potential asymptomatic spreaders of COVID, right? So we don't go around, at this point, we're not in the position of being able to test everybody before they have symptoms. So we are preparing them to mitigate, right? And the mitigation goes around the education. It goes around providing them the mask, the gloves if they want it, the hand sanitizer, and encouraging them to use that and to observe their social distancing when they're on that trip. So it really is about mitigation so that they don't get it. And then what do you do when they come back? That is when you have to answer the question about self-quarantine, about whether or not they get tested, which again, we wouldn't recommend testing without symptoms. But you could go into self-isolation before they go back to work, right? And then obviously you have all of your return to work procedures like temperature screening and answering questions about symptoms before they go in.
Sir, did you want me to comment there?
Yes, please, Dale. Yeah.
Yeah. Look, I don't disagree with anything Matt said. The only thing I can add is I ask, our client base this all the time. As you defined this, the first thing that comes to mind in this COVID era as we start to open back up, let's assume that's where we're headed here with this question. My first question, first and foremost, is always this: how do you define who is key and essential and that they have to do this in person? I understand I have financial clients, banks, private equity firms, hedge fund managers, all those are clients. And I understand if you're doing an acquisition and there's millions of dollars on the table, maybe billions of dollars on the table. I understand if you're going through an acquisition and you've got to build trust with the entity you just acquired, those are transactions that require trust, meaning you can't build trust through this medium that we're on right now. It's not going to work. So as you look at this, My question first and foremost is, number one, to Matt's point, can you get in? How safe is it? What are the numbers? Do that evaluation. Two, more importantly, have a well-defined criteria of what is key and essential. And if you answer that question and you're willing to take the risk and you understand the risk, then go. And then I think obviously you follow the protocol. It really does. In the short term, in my mind, it comes down to, do you have to build trust? Is it something you cannot do through VTC, through email, over the phone? And if so, understand the risk and then execute it and put all the risk mitigation strategies in, and you're going to, have your best shot at success.
Great, thank you. We've had 3 more questions that come through. When can we expect travel to Europe to be reopened without quarantine requirements?
I'll start on that and let Dale. I don't have the crystal ball, and I don't think we can make a prediction about the timing around that. Obviously, every country is looking at what the rates are in the United States to make their decisions about when people can travel into their countries. So Europe is going to do the same thing with the United States, but they're going to want to, because they're not going to be able to treat each U.S. state as a separate country. They're probably going to make decisions about the United States as a whole until we get it under control in every state, because they won't want to say, have you been in Texas? Have you been in, Georgia, or have you been in Florida or someplace else whenever you're arriving, and letting people in from states that have lower rates. So I think it's going to be months until we have those things under control in the United States. And that's when you can look at places reopening without quarantine requirements. I don't know, Dale, if you have a prognosis on that.
No, I would say this, we going back, we were briefing clients in April on webinars thinking that we would have this under control by fall. It's clearly not there. So to Matt's point, we can't give you a date. We had branded this as the last quarter of this year. We thought we'd start to open the globe back up. I now don't think that's real. So I do think in simple terms, when we have flattened the curve as a country, and as a whole as a country, we are now seeing negative rates in both spread and deaths. When that occurs, and we appear to meet the criteria for phase 3 that the federal government has put out, at that point is when I do think Europe will open itself to the United States, and not prior.
Okay, I'm just conscious of time. I think we can get these last 2 questions in. Even if we had a vaccine, how long would it take for the global immunization process? How long would that take? And the other question is, if there is no vaccine, what is the prognosis for global security?
I'll take the first one real quick, and then Dale, I'll let you start on the second one. So I think you're exactly right. We are talking about years. Again, the vaccine timeline includes development, testing, manufacture, and deployment, right? And that's assuming that the vaccine that's developed, has a high effective rate and also has a single use, right? So that you're vaccinated once forever with 1 dose. So if all of those things were the case, you'd still be talking about 8 billion doses that are needed. And how long does it take to deploy that, right? So again, timeline for vaccine to everybody, years, right? A couple of years probably for all of those things to happen. And then obviously taking into account that maybe not everybody would accept the vaccine or take the vaccine. And then if it's not effective in 1 single dose, or you have to get it every year, then you have to repeat that process every year. So it might not even be possible to get everybody vaccinated before the vaccination needs to be done again. So certainly complicated, but the process of development, testing, and manufacture has actually been reduced quite a bit by all of the pharma companies working on it the way they have been lately. So Dale, do you want to take that second one about the prognosis for no vaccine?
My only other comment on the vaccine part is the assumption here is we don't have to vaccinate every human being on the planet. I think as the West, being the United States, development countries, Western Europe, things like that, as we get the vaccine distributed across those parts of the world, we will start to feel confident, which goes back to confidence matters. And once we feel confident, then this thing will start to open up, and it'll start with the developed world for sure. We're not going to get everyone. It's just not realistic. 2, on the security side, I think, look, if you're seeing deterioration desperate people doing desperate things. To Matt's earlier point, if Somalia was a high-risk country before COVID, it's certainly a high-risk country and then some now, right? So because the supply chains have stopped, the little bit of GDP they had going has probably plummeted. So everything is accentuated. If we don't find a vaccine, you're going to find that pockets of plight are just going to get worse. The developed world is going to come to some kind of semi, it's going to protract and then stay there. And at that point, we're going to have a new normal, and that new normal is certainly not what all of us have been enjoying as Americans or Westerners for the last 100 years. So that is a thought that where places were bad before get worse, and places that were doing quite well find themselves in a position they've never been in from a security standpoint, because you'll have a population of desperate people that the economy does not work for them, the system does not work for them, and they find themselves in a really desperate position. That's how I would answer that. And it's quite bleak, unfortunately.
We are out of time, but thank you, everyone. It was a great presentation. Thank you again, Dale Buckner, Matt Bradley. We looked forward to maybe having you back again, but these were excellent presentation, great questions, and thank you, everyone. Have a great afternoon. We'll see you in 2 weeks. Bye-bye.
Thank you. Thanks, Matt.
Thanks, everyone.